Okay, go.
Okay, my name is Eric Curtis. I'll be doing a neuro assessment for nursing 383. My colleagues Amanda and Kathy. I'll start by washing my hands, and then I'm going to do a general assessment. Amanda appears to be well nourished, well hydrated, does not appear to be in any acute distress, is very alert and attentive, well groomed, especially for the time of year. So overall appearance is good. So we'll start with cranial nerve number 5, the trigeminal nerve. I'm going to have you start by clenching your teeth down tight, and we'll check for that muscle symmetry there, and that is all good. And then I'm going to demonstrate here. This will be soft and sharp, and I'll just have you tell me what you feel as I test each spot, okay?
Soft. Sharp. Sharp. Soft. Soft. Sharp.
Okay, good. So cranial nerve number 5 is intact. Moving on, we'll do cranial nerve number 7, the facial nerve. We'll check for facial symmetry, so I'll have you smile at me and show me your teeth. Nice and even on both sides. I'll have you puff your cheeks out and don't let me push the air. Okay, good. Push your lips for me. All right, good. Then I'm going to have you close your eyes tight and don't let me open them. Okay? And then raise your eyebrows up. Yeah, wrinkle your forehead. Perfect. Okay, good. Cranial nerve number 7 appears to be functioning just fine. We'll go on to cranial nerves number 3, 4, and 6. The oculomotor, trochlear, and abducens. So I'm going to have Amanda, I'll have you look straight ahead without turning your head. I'm going to have you follow my finger, okay? So just focus on my finger. Just have your eyes follow. Good. Down. Okay, and both eyes are following my finger perfectly. Okay, good. I'll do the corneal reflex test. So I'm going to take this cotton and I'm going to approach your eye. Okay, I promise I won't stab you in the eye. And as we approach, she blinks before I even touch her eye. And we'll do that on both sides. Yep, perfect. Okay, so corneal reflex is intact. So I'll check her direct pupillary response now. And I'm just going to shine a bright light in one eye at a time here, okay? So just look straight ahead, right on past me. And the room will be dimly lit, of course, when we do this. Yep, pupil constricts. Pupil constricts. And we'll do the consensual reflex, so as I shine a light in one pupil, the opposite one constricts. And that is to be true. So her pupils are about 3 to 4 millimeters. So now we'll check your accommodation. So I'll have you look straight ahead, focus on a spot on that wall. Okay, and then I'm going to hold a finger up. Now I want you to focus on my finger. Okay, and then focus far away again. Okay, good. So her eyes converge onto my finger there. So we can say her pupils are perla, equal, round, and reactive to light and accommodation. Next cranial nerve we'll assess is nerve number 2, the optic nerve. This is where I would have her, to check her visual acuity, I would use a Snellen chart. However, I don't have a Snellen chart here. But I do want to check your peripheral vision, so I'm going to have you just lightly cover one eye. Okay, and then I want you to tell me when you can see my fingers.
Okay. 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 Okay.
Okay, and then cover the other eye, and same thing.
Okay. 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 No.
Okay, and so her peripheral vision is plenty adequate. After we do an optic nerve, or the optic nerve, we'll move on to cranial nerve number 8, the acoustic nerve. So we'll do the whisper test. So what I'll do is I'll stand on one side, I'll have you cover the opposite ear lightly, and then I'll whisper something, and then you just repeat what I say, okay?
Eric rocks.
And on the opposite side?
Kathy rocks.
Okay,
It's true.
So cranial nerve number 8 is intact. Moving on, we'll do cranial nerves number 9 and 10, the glossopharyngeal and the vagus nerve. Amanda is alert and talking and swallowing, so there's really no need to check her gag reflex. However, in an unresponsive patient or a patient that is has a very altered level of consciousness, you would want to check that. Also checking that, I'm going to have you open your mouth and say ah.
Ah.
Again?
Ah.
Okay. So her uvula goes up and down and is symmetrical, stating that those nerves are intact. Moving on to cranial nerve number 12, the hypoglossal. For this test, we'll just have you stick your tongue out, straight out, and then go side to side with it. Okay, good, perfect. That is the assessment of all the cranial nerves. So to finish up the neuro exam, we'll just do a few different tests. The first one is finger to thumb. I'll just have you, yep, perfect, okay. And then I want you to take your heel of one foot while you're sitting there and just go right down the shin, perfect. And then the other one, okay, perfect. Okay. And then I'm going to hold the finger here and then alternating finger, your forefinger, I want you to touch your nose and then touch my finger, my index finger. Okay? And then I'm going to go here. Okay. Other hand. Okay, good, perfect. And then, so I'll have you stand straight up. Okay, and then I'll have you turn that way and just walk normal towards the door there. Okay, good. And on your way back, do a heel to toe. Okay. All right, good. So Amanda's got a balanced gait, no wobbling from side to side. And the last test I'm going to do is the Romberg test. So I'll just have you stand with your arms at your sides, and I'll be here to guard the patient in case she becomes wobbly. So with her eyes open, she's nice and steady. Now I would do the same thing with your eyes closed. Okay, and she's very steady. And so that's a good Romberg test there. So that concludes our neuro exam for 383. I'll finish up by washing my hands. And thank you both for helping me.